Thank you so much, IT Cell, for your kind cooperation. And now, may I request HOD Political Science, Dr. R.S. Dalal, and also the director of this event, for the introduction of today's program and the welcome address. So, Dr. Dalal.
Hello. Hello,
Yes,
Sweta.
sir.
Am I audible?
Yeah,
Yes,
Shobhita,
sir.
you are
You are
audible.
clearly audible.
Thank you. Thanks a lot. I would like to extend the heartiest welcome to our Honorable Vice Chancellor, Professor R.C. Koharji, who is kind enough to be with us on every moment. Hello. डॉक्टर साहब कोई डिस्टर्बेंस तो नहीं है आवाज में?
नहीं सर, ठीक है सर।
अच्छा, ठीक है सर,
ठीक है।
हाँ
प्लीज कंटिन्यू।
हाँ, no doubt today's Dr. R.C. Koharji is very much busy in a very important meeting. In spite of that, Professor R.C. Koharji has assured us that as and when he will be free, he will join this program. So with the blessings of our Honorable Vice Chancellor, we are carrying on this series of lectures as Madam Sveta has recently pointed out. It is our 5th event. We have very eminent speakers on this topic from different parts of the world, including from Nepal, from Helsinki, and today we have the very eminent speaker, Dr. Nirmala Devi Gopal, who is head of the department and Dean, School of Applied Sciences, KwaZulu University, Natal, South Africa, and on a very pertinent topic. Madam, I welcome you on behalf of myself, on behalf of our department and university, and we are really delighted to see you and to listen you how and on what aspects the Indian COVID fighting strategies differs from that of the South African. We can learn a lot from this. The very purpose of organizing this event, such type of lecture events, was that we want to make people more and more aware regarding this pandemic, because as all of us know that prevention is better than cure, and it was rightly pointed out by Dr. Gupta ji and Shailendra Tomar ji, who are the physician doctors in real sense, that the disease demands more prevention than cures, because when we talk about the cure, we have a number of limitations also. So I really feel very privileged, and we have proud that we have a speaker like that of you. You are really welcome. Then I extend my heartiest welcome to my esteemed faculty members from both the Department of Political Science and Department of Geography. Dr. Vinodji, who is the Dean and Head of the Department of Geography, he has always been an inspiring force behind the events and always be ready with us. Then I extend the heartiest welcome to all our deans, directors, faculty members from the university, our esteemed participants, particularly our research scholars, students, as well as other participants from India and abroad, particularly from South Africa. My welcome to all other participants also, whose name I could not take due to one reason or the other. Dear friends, so far this topic is concerned, meticulously our team led by Dr. Santesh ji and Dr. Manish ji, they have prepared, and after a brainstorming efforts, they came out with this conclusion that we should hold a series of events, particularly in form of lectures of international level on different aspects of COVID-19. COVID-19 pandemic, it's what are the issues, what are the challenges, and how we can settle or come out with these problems. I think, as Saveta has initially pointed out, we have taken 5 different dimensions, and to a greater extent, we are in a position, and that has been rightly appreciated even by the World Book of Record, in which we have been mentioned, or the World Book of Record director has appreciated the efforts made by our university regarding the awareness of the people regarding the ill impact of the pandemic, how we can save it, and what are the other precautions we can take here. Today's our topic, with which Dr. Nirmala Devi Gopal madam is with us, that is very pertinent, very relevant one. India versus South Africa, strategic points, how we can, how our strategy differs from that of South Africa. So far, the casualty, mortality or fatalities are concerned, what the government of South Africa and the government of India, they took precautions, and how, to what extent South Africa took the lead as compared to India, and how and on what fronts we took as compared to these. Friends, as we know that, and during a lot of discussions, it has come out that there are 3 aspects so far this pandemic is concerned. And the first and the most vital one is that of awareness, prevention. We have to see what precautions we can take against this disease. In today's lecture, madam will also point out that by using the 3T mechanism, that is one of the testing, tracing, testing, and tracking concepts are there. And only on the aspect of testing, South Africa lead to India. They did it almost on 1 million population. Their target has remained about 1500, and to that of our is far lesser, almost 1/5 of that one. No doubt, India, if we talk about that of curative efforts, in preventive efforts, we talk about that of vaccination also. No doubt, are we made a record by vaccinating a number of more than 85 lakh doses of vaccination in a single day. But if we see the population, huge size of population of India as compared to that of South Africa, that is, I think, far lesser as compared to that one. So I think Dr. Gopal will certainly point out all these issues, on what fronts India varies or differs or lags behind that of South Africa, how the South Africa tackled the pandemic effectively and efficiently as compared to us in the second wave. So far, all of us know that in the first wave of pandemic, Indian government and state government, they efficiently worked in a tandem, and that's why the casualties was very lesser. But in the second wave, such cooperation, coordinations that was lagging, and the result was before us, that we have to face the highest number of cases in the world in a single day, when it rose up to 4 lakh on 21st of May, and the casualty was almost the equal number, 4,000 people die in a single day. That is also, and I think some other cases are also there which could not be traced or noticed due to one reason or the other. So with this, I would like once again to congratulate, welcome, and hope that Dr. Nirmala Devi Gopal will certainly take up all these issues which are expected to be taken today, that how both these countries took their strategies to meet out the pandemic, and where on what points we have the failures, or we can say we are lagging behind, and on what fronts South Africa has taken the lead and what we can learn from that. It not only comprises of the aspects of just of mass using of mass social distancing or other preventive measures. That is also preparation of the co-vaccine or other vaccinations, that may be Covishield or the target to meet out it, but also the curative one, preparation also have been given signals by the World Health Organization and other agencies that we should also be ready for the third wave, maybe in September, October or November months. So in that situation, we need to learn a lot by such type of collaborative discourse or discussions. So with this, I once again welcome all our esteemed participants, particularly our Honorable Vice Chancellor and our today's speaker of the day, Dr. Nirmala Devi Gopalji. Or with this, I hand over the mic to Dr. Saveta for further proceedings. Thank you.
Thank you so much, sir, for your warm address. And now, may I request Dr. Shantish Kumar Singh, Associate Professor, Department of Political Science, and also the convener of this program, for the introduction of our guest speaker, Dr. Nirmala Devi Gopalam. So, Dr. Shantish.
Thank you. Thank you, Sweta. Thanks a lot for inviting me to give a brief introduction of Professor Nirmala ji. Definitely, I will give introduction. That is what my duty is in this webinar. But before that, I would like to mention a few of the points regarding this webinar. Why we have scheduled, why we have planned to organize a webinar on this topic. This is what we have to understand. Being a student of political science, we all are very much, am I audible, Sweta?
You
Yes,
are?
sir. You are audible now. Yeah, okay. So why we have, being a student of political science or any subject in social sciences, we have very important approach to look into the issues is known as like comparative perspective. That is what we do usually. So in this topic, we are going to have a comparative analysis of these two countries, like India and South Africa, how these two countries have tackled or fight against this monster, namely basically COVID or coronavirus, which has threatened the existence of human being on this earth. I'm just saying on this earth because it has impacted badly, hugely, not only our day-to-day life pattern. At the same time, it has impacted our economic order, socio-cultural order. So here, I would like to say my students, particularly because they are students of political science, like these two countries are basically part of BRICS and IPSA. These two are regional organizations or not regional organizations. These are global organizations, multilateral organizations, which are working together to to maximize their national interest through different dimensions, different means. And definitely, whatever good things are there in South Africa, we have to learn. Whatever good things we are having in India, South Africa and other nations, developing nations should learn. And that is what the objectivity of this BRICS and IPSA kind of global organizations. They are working together to protest, raise their voices against those countries which have been, developed countries which have been, in dominating positions, which have been, controlling positions. So in this talk, definitely we are going to hear a lot of things related to all these things. So now I'm going to give a brief introduction of Professor Nirmala Gopal. She is basically currently a criminologist in the Department of Criminology and Forensic Studies in the University of KwaZulu-Natal in Durban. She recently acted as the dean. This is what I am quoting. While we approached her to deliver lectures, she was dean at that time, but recently she has completed successfully her tenure as dean of the School of Applied Human Sciences at the University of KwaZulu-Natal, and she was head of the department too at that time. At present, she is only professor in that department. Among her focus of research is hidden and vulnerable communities and victims of crime, social injustices, and discrimination, with the aim of promoting justice and fairness for unequal groups in society. Her current research focus area is cybercrime and cybersecurity. She has published extensively in this area. She has completed research on school-based violence in disadvantaged communities and proposed coordinated approaches to confront violence. Professor Gopal, an NRF-related researcher, has multiple publications in peer-reviewed national and international journals. She has showcased her latest research interests cybercrime in a special peer-reviewed journal released in November 2018. The journal is frequently referenced by national and international criminologists. The title of the special edition is Acta Criminologica, a Southern African journal on cybercrime. In addition, she has concluded a national study entitled Cybercrime Risks to South Africa. She has keen interest in mentoring young career academics. And this last point I'm just quoting here. A few years back, while I was in Delhi University, she visited my college and she has a workshop that was being organized for basically my students who were basically studying at that time in graduation. So this is what the shows how much is indulged in basically giving training to basically young students, young scholars, and see, this is what she is doing. And for that, definitely, I would like to mention another name. She has joined Bobby Luthra Sinha. She was the one who had played a role of bridge between me and basically Professor Nirmala Gopal. Thank you, Bobby, for that, for introducing me to Professor Nirmala Gopal. With these words, I'm stopping here, and definitely we'll have more discussion in that of this lecture. Sweta, for further proceeding.
Thank you so much, sir, for the beautiful introduction of our honorable guest speaker, Dr. Nirmala Devi Gopalu. Now, ma'am, before handovering this mic to you, I would like to share one thing that, ma'am, you are the first women speaker in our this entire journey of international lecture series and in the various programs organized by the Department of Political Science. So it's a great honor of mine, ma'am, to welcome you and to share this platform with the dignitaries like you. Again, welcome you, ma'am. And now mic is over to you, and we are very excited to listen you, ma'am. Thank you so much.
Thank you very much, Shweta. If anybody cannot hear me, will somebody alert me? Give me a thumbs up.
You're audible.
Ma'am, you are clearly audible.
Thank you very much. So please give me a second to share my screen. Okay, this is a new platform for me, so I'm trying to locate my PowerPoint. All right, is that visible? Is my PowerPoint visible?
It's not, I think,
it is not coming, ma'am. Screen is shared, but the slides are not visible, ma'am.
Yeah.
Yes. I have a copy of it. Are you able to?
Have you sent your PPT? Yeah, you have sent, I think.
Yes. Unless I send it Shweta?
डॉक्टर डिस्प्ले कर दो इसको या शांतेश जी डिस्प्ले कर दें अपना सिस्टम
Can
से
you see?
इफ यू कैन डू हाँ यस यस नाउ इट इज
Okay, but you can
मैम
also see.
Yeah, it's
I
coming.
don't.
It's coming. Yeah, yeah.
Okay, but I don't want myself to be showing. Is there any way you can take me up?
Yeah, that will be okay. Now it's
All
visible.
right. It's visible. Okay, thank you so much. So, good morning, first of all, to Dr. Shantesh Kumar for this very privileged invitation. Good morning to the esteemed guest, to Dr. Shweta for that very pleasant introduction. I want to take this opportunity to greet Dr. Bobby Sinha as well. Just by way of introduction, as Dr. Shantesh had mentioned, towards the middle of or early 2017, I did visit with him, and it was the first time that we met, and it was a very pleasant experience. On very short notice, he was able to organize a really good discussion class with one of his classes. So I'm really grateful that we were able to sustain this relationship. And 4 years down the line, we were able to reconnect. And I'm really hoping that we are able to take this relationship forward. We come from the global south, and I think these kind of discourses and narratives are extremely important, as the representative on behalf of the Vice Chancellor mentioned as well. Of course, although I belong to the discipline of criminology and forensic studies, my research interests are quite vast, and quite a significant portion of my research resides in politics, partly from my own personal interest in politics growing up as a young student in South Africa that's highly political, that has been highly political and continues to be highly political in nature. So a great deal or a significant portion of my research lends itself to the political discourses in South Africa. So moving on, in terms of my presentation today, comparing or looking at South Africa and India's responses to COVID-19, at the outset, I want to mention that given the fact that data is still streaming in, and we don't know we know more than we did in 2019, but certainly we will know more in around 2022, 2023. And I think that as the pandemic progresses, hopefully not though, but as data becomes available, we will be in a stronger position to start making better comparisons. And I think engaging in wide-scale research opportunities between India and South Africa as well. But as we stand, I think this is quite discursive at this point in time. So we all are aware that the outbreak of the virus in 2019 posed a public health threat, but also a developmental challenge. And some of us would now be aware that because of the fact that we belong to BRICS, South Africa and India belong to BRICS, and the founding principle of BRICS was for develop economic development purposes. So the COVID-19 came at a very untimely, was very untimely, because it's a time when BRICS is concentrating on economic development of the BRICS countries, and then we dealt with this huge blow of the coronavirus. So of course, across the world, countries who adopted a plethora of strategies to mitigate this novel virus. Several infection prevention and control strategies were also implemented. While the WHO had given directions as a global health watchdog, countries, of course, had to also adopt specific strategies that were feasible based on their own context. And we, of course, also are aware that we have less resource and better resource countries. So the less resource countries struggled more than the better resource countries, although initial projections and data showed us that it was the West that suffered more than it was the North that suffered more than the South. So this presentation first focuses on South Africa and then moves on to India, giving us snapshot profiles for each country. Now, when we compare the profiles of South Africa with India, I think one of the foremost ideas that comes to mind for me is the fact that both our countries were colonized by the British. And as a consequence of the colonization or the decolonization, or when independence was granted, both our countries suffered huge financial losses. So we started off on a very low base in terms of resources in the countries. So when we look at South Africa, for example, there are various descriptions. It's a developing country, others call us a middle-income developing country within the Southern African context. And that, of course, is in comparison to other poorer countries in Africa. It's located on the southern tip of the African continent. Our population at the moment is around 60 million. We are host to a large cohort of migrant or foreign national individuals, largely because of wars and other natural catastrophes in Africa. So according to, by the middle of the year, at the middle of 2020, we stood at about 59 million people. And that equals 0.7% of the total world population. We rank at number 25 in the list of countries and dependencies by population. Our density is 127 people per square mile. And of course, the rest gives us the geography of the country that we live in. This is a map of South Africa. It's made up of 9 provinces. The largest province is the Northern Cape. I live in KwaZulu-Natal. I'm not sure if you can see me pointing this out to you. It's the peach colored province on my right-hand side. So in terms of the numbers of COVID positive individuals, Western Cape, Gauteng, KwaZulu-Natal, and Eastern Cape and now Free State are leading in the pack. So the first confirmed case in South Africa was reported on 5th March, and it was characterized as an imported case. It meant that it came in from one of the Western countries. About 3 weeks later, the president, Cyril Ramaphosa, announced a nationwide lockdown. Now, initially, when South Africans heard about case 0, there was some kind of hype, but I don't think that people necessarily understood the impact that case 0 was going to have in the long term on the health and socio economic spaces in South Africa. But what this did is, during the time of the 3-week period between case 0 and the 23rd of March, the National Command Council, which was formed by the president, took the time to prepare the country's health system for the influx of moderate to severe COVID cases. Now, the lockdown was not accepted very well by large parts of the industry, owing to the fact that South Africa already had and continues to have a very high unemployment rate. We're sitting at between 27 to 35% of unemployed adults, employable adults. And then on August 1st, South Africa's Minister of Health made the grim announcement that more than 500,000 cases of virus had been confirmed in the country. This tally meant that South Africa was by far the most hard-hit country in Africa and was accounting for half of all reported infections for the continent. Now, the next statement is really critical, and it says globally, South Africa has now ranked as the 5th worst affected country, followed by the USA, Brazil, Russia, and India. And so the only country that's not part of BRICS here is USA, but South Africa, Brazil, Russia, and India are all part of BRICS. I think that's an important point to note going forward in terms of what kind of assistance we think that the BRICS countries could afford to each other. So the government's response, stage 1 was preparation, community education, establishing laboratory capacity, surveillance, primary prevention, social distancing and hand washing, closing schools and reduced gatherings. They also closed borders to international travel. Unfortunately, this particular picture shows us that although social distancing was made mandatory, it wasn't really possible with a large amount of people in the country and not knowing whether everybody was getting the communication, that social distancing is lacking in this particular pic. So stage 3 was the lockdown. It intensified curtailment of human interaction. Stage 4 was surveillance and active case finding. And I think this was a part that the health ministry took very, very seriously, because at this point in time, we could see the numbers that were moving upwards. Now, during this time, one of the great challenges that we had was the fact that we have large numbers of our citizens living in informal settlements, and these informal settlements are bereft of running water and sanitation. And the fact that one of the critical preventative methods was to wash hands thoroughly using clean running water and soap. Now, we began to realize, or social scientists began to realize, that in the absence of these facilities, how possible does it make it to reduce transmission through touching? So the social strategy placed the responsibility to promote COVID-19 prevention and control on the individual. And this became quite difficult for most individuals. In the face of the ravaging pandemic, it emerged that non-pharmaceutical essentials are clearly the bastion of COVID-19 prevention and control, particularly given that there was no vaccine at first, and when vaccines were rolled out, reaching herd immunity is not the only challenge, because even those who are fully vaccinated are not immune to infection. And then, of course, it raised other questions that were coming through the media on the efficacy of vaccines. We do know even currently the new strains such as Delta and of late Lambda are discovered as the pandemic, have been discovered, and they too pose a serious challenge to the pharmaceutical or medical strategy. So in terms of the economic recourses, the South African government dispersed social relief of distress grants, that is $20 per day, to all South Africans who are unemployed, including those who lost their jobs as a result of the pandemic. And this lasted for a period of 6 months. But sadly, even here, people who were eligible for these grants had to stand in long queues where social distancing was not followed. And the questions that onlookers raised was that, is this helping in any way to reduce the the transmission, or are we just creating fertile grounds for the transmission of the virus as well? At the same time, the government also increased the value of the child and social support grants until October 2020. This, of course, this provided some kind of relief to poorer parents, especially those who are unemployed, and many of whom have on an average of 3 to 4 children. The government also pledged a business relief fund of 500 million for businesses that may have had their operations affected. And I'm not sure if the international community had any information, but herein lay many corruptive activities, some of which are still being managed by the legal system. Then the government provided tax subsidies for small businesses and individuals in order to lower their contributions to the UIF, the Unemployment Insurance Fund. In terms of the economic impact of COVID-19, we saw a vast decline, and that is not unexpected. Okay, this is sharing of food. We had many philanthropic organizations and NGOs that were dispersing food to poorer people in the country. Medically, we had testing, PPEs, and ICU admissions for frontline workers, and of course, vaccinations for frontline workers as soon as the vaccines became available. We've already done, this was the rollout plan in terms of we started frontline health workers, then essential workers, people, pardon me, people in congregate settings, people over 60 years. At the moment, we've started registering people between the ages of 35 and 45. It's moving quite smoothly, but I think there's a lot more that has to be done, especially in rural areas where media attention doesn't reach them very easily, and also perhaps a little bit of naivety around the impact of the vaccine on their own medical conditions. Okay, legally, masks were mandatory, but of course we know it's almost impossible to police mask wearing and social distancing, so it's somewhat effective, but I think citizens who are afraid of actually contracting the disease are more vigilant around this. International travelers now are required to produce COVID-19 testing certificates to countries where international travel is allowed. So in terms of India, I'm a little bit nervous to present this because I'm not the authority, but this is from available data, and I'm really looking forward to having some discussion from the participants in terms of how similar or how different we have been based on my available information. So we also know, and you know this, India is a vast country. In comparison to South Africa, we are a baby. India's population is around 1.3 billion. We have 60 million, and I don't think by any means we can compare the two population sizes. Of course, per 100,000 we can do that, but we know that we're dealing with a very different animal when we speak about India. Okay, so India's population is equivalent to 17.7% of the total world population. It ranks number 2 in the list of countries and dependencies by population. Compared to ours of 27 people per square mile, you have 1,202 people. 35% of the population is urban, and the mean age in India is 28.4 years. The map of India, I've been to a few of the your states in India, which I found really beautiful, and I'd love to revisit once travel bans are lifted. In India, the first case was reported on 30th January. The population, okay, it was considered a mammoth task, given that India is characterized by widening economic and social disparities and distinct cultural values, which have potential to present unique challenges. However, the Indian authorities acted really swiftly, and I must admit that South Africans were very admired the way in which the Indian authorities acted, and is commended for the world's largest lockdown. The World Health Organization described India's response to the threat to lockdown as a strategy using the phrase tough and timely. The lockdown helped India in buying critical time for extensive contact tracing and, most crucially, time to prepare the health system. It was very similar to South Africa and I suppose the rest of the world. Increasing its healthcare infrastructure and preventing it from overwhelming it as it happened in Italy and the United States and Spain. It followed a two direct observing lockdown and ramping up the healthcare infrastructure. A huge evacuation program of many Indian nationals was done from the COVID-19 affected areas. For example, something that India did really well was the use of telemedicine. Amenities such as hotels, colleges, railways, coaches were converted to quarantine facilities. Epidemic Diseases Act helped to quarantine suspected cases and closing down public spaces. In addition, mass gatherings were banned. But given all of this, I know via the media, we were still able to look at the number of people that were dying as a result of COVID-19. But again, we took into account the fact that India does have a huge population. I think one of the worrying features for South African Indians especially was having to see the bodies that were being burnt and thrown into rivers. And I think that was something that was very difficult to digest by the South African Indians. Medically, India boasts of the world's largest COVID-19 immunization program. And by 8th February, about 6 million people were vaccinated. This is just a pic of your vaccine rollout. Social distancing markers in India. I'm not sure how widely this is practiced, but looking at this, it's very impressive. So we all, as we know, the economic impact in India has been disruptive. The growth went down to 3.1% according to the Ministry of Statistics. And this drop is mainly due to the coronavirus pandemic's effect on the Indian economy. Notably, India has also been witnessing a pre-pandemic slowdown, and according to the World Bank, the current pandemic has magnified pre-existing risks to India's economic outlook. And again, here I think going forward, it would be imperative for us to look at how the BRICS countries can help to resolve some of these economic slowdowns and economic developments that we need to redefine ourselves with. Strategies to economic impact. The government has subsidies, food packages. Here's an example of your food packages, but sadly, hardly any wearing of masks again. But I don't think this is very different from South Africa, because when we think about hunger versus health, one begins to wonder which becomes a greater need. I want to thank you very much for both the opportunity as well as for listening to me. I'm now very happy to take some questions. Thank you.
Sweta ma'am.
Thank you. Thank you so much, ma'am, for sharing your broader vision with us. And I think you very beautifully compare the strategies adopted by South Africa as well as India at the time of pandemic to overcome from the situation. This lecture would be very fruitful, and one thing I must say, alarming for all of us. Again, thank you so much, ma'am. And now, with these words, I would like to call Dr. Shantish Kumar Singh, Associate Professor, Department of Political Science, for the concluding remarks and question answering session. So, Dr. Shantish, over to you.
Yeah, thank you, Sweta. Is there a question to ask? Even query? I'm just opening this platform for discussion. If there is any question or query to raise to Professor Nirmala. बच्चों को किसी कुछ पूछना हो कुछ पूछ सकते हैं हमारे पीएचडी स्टूडेंट जो हैं और जो एमए के स्टूडेंट हैं.
Any question, query, or any kind of understanding, students?
I don't think they have any question.
Because the things are very much clear, so so that's why I think.
No. Professor Nirmala, I have a small doubt for this ongoing crisis. Just want to know how South African people perceive about the ongoing crisis in India. Like in second wave, India is struggling to cope up with this problem of basically COVID. So how do you see? I mean, South Africans see to this crisis of India's fight against COVID-19 wave 2. Yeah.
Thank you very much, Dr. Shantesh. I think I can just give you, at the moment, I can only give you anecdotal conversation evidence, and largely from, because of the lack of movement, etc., it's largely from the Indian population. And I must say that the South African Indians or Indian South Africans are very much, what is the word? There's a feeling of helplessness. You know, we are in South Africa, the Indians are going through this second wave. What can we do? And I think there were some efforts to provide, and I think the gift of the givers were doing some, they had some, what is it, activities where they were trying to send, I don't know if it was oxygen tanks, but I know there was a lot of worry and concern for Indians in India. Yes, I think it also took us by surprise because for many of us, India is one of the leading health experts, and your infrastructure is really amazing. For those of us who have been in India, taken ill in India, myself, my own experience is that the medical treatment I got was just so amazing. And I came back with really good reviews about India's health system. And I think there were other colleagues who did that as well. So it was quite surprising to us. But on the other hand, I think that the population numbers is what worries us. The fact that you have such a huge population must mean that your health system is going to take strain. And I think in addition to that, I'm not really certain about the social distancing and the availability of sanitation. What are the real causes? And maybe that's something that we could look at as a collaborative study. What are the causes what is it, your high impact areas, your high infection rate areas that cause these infections? And yeah, I think that's a fertile ground for some research. But I also want to say that South Africa's just begun the third wave. So you are one wave behind us, but then we are experiencing winter and you are experiencing your summer at the moment. So it's very likely that your third wave will be soon. And just to say, and Dr. Shantesh knows this, that as I speak, I've just been tested positive as well 3 days ago. But I couldn't change this the presentation any longer. Yes, so that's my response.
Yeah,
I
please.
hope that kind of help. I see there's there is a question here. Let's see if I can read it. We know how the education incident, especially research, contributed in the challenging situation.
Yeah, questions are now they started coming in chat box. So now we have more questions. If you want, I can read that for you.
Yes, please.
Okay.
Yes, please.
The student, PhD student working under me, Radha Chauhan, is asking like, please suggest any steps India should learn from South Africa to tackle COVID-19. And definitely, I would like to add in that, and what lessons in South Africa can learn from India to tackle this COVID-19.
Yeah, I think that's a more pertinent question because I think we're learning from each other all the time. South Africa is learning from the rest of the world is learning from South Africa. But I think one of the big things that we've learned from India is the rapid rate at which your vaccine rollouts have taken place, in addition to the fact that you have facilities, large-scale facilities to produce the vaccines, which we were unable to do at the beginning. I think you may remember at the very early onset, September, October 2020, we received a large dose of vaccines from India. Unfortunately, something went wrong with it, but it was a very welcome gesture from the part of India. And I think politically for South Africa, that those are really great moves, to South Africa because of the diasporic presence in South Africa. It really, it takes us a peg or two higher in terms of how South Africa actually collaborates with South Africa. In terms of the research institutes, of course, there are bits of research going on, but I think the focus at the moment is on the variants, the mutations, and at the moment, what we are receiving frequently are updates on the mutations. We are receiving updates on infection rates, and these are some things that many people are obsessed with to some extent, which may not necessarily be the best thing because you start to suffer from statistics paralysis, and it can hold you back from doing other things. So I think that's where we are in terms of this at the moment. I haven't really, besides the media reports, which I think are pretty accurate, we haven't yet with any of our own vaccines. We're trying to reproduce, but not our own vaccines yet, because the variants are similar across the world. So even the South African vaccine has been taken care of. And I think the Delta vaccine that came from.
Yeah, thank you. Thank you. And there's another question is from Ravi Shankar Raj. He's asking like, is population a roadblock to deal with unemployment? As we can see that in South Africa provided with some grants to unemployed, but in India, we don't find any such grants. What is your take on this?
I think given its own, South Africa is just so embattled in politics. And I'm not sure how many of your students actually follow South African politics, but we say from about 2008 until about 2018, we went through a very serious state capture. And unfortunately, it was the Guptas from India, I think, or Dubai, who were so embattled in the state capture, where we lost billions and billions of rands. And I think that the feeling or the opinion of citizens is that those are the kinds of monies that could have gone into job and creation, etc. So unemployment, the population is not necessarily is not a roadblock to dealing with unemployment. I think it's the lack of will from the government to create the jobs, because we are channeling the monies into spaces that they shouldn't be. And that is, I'm not sure if you're aware at the moment, our previous state president has just been imprisoned for not adhering to appearing in court. And as we speak, we have protest action all around us. And all of that is related to corruption in the country. I think if we are able to deal with the corrupt situations which our President Ramaphosa is really busy with, I think in the next 5 to 10 years, we will see the unemployment rates decrease.
Yeah, thank you. And there's another question from Mudassar Fardosh Loan, and he has mentioned like COVID, like is COVID good or bad? And it's known to all like COVID is not good for economy, but what about other sectors? How is it affecting the life pattern? I mean, socio-economic condition and political situation of country. So, what is your take on this? He wants to know that. What I understand
Okay.
from each question.
Very interesting question.
I think we are in South Africa, especially people living with comorbidities have been really badly affected, and of course, I think this is a very biased view, but because we kind of keep an eye on our own race groups as well, many Indians believe that the Indian population have been disproportionately affected in terms of deaths. But we also justify that by the fact that our eating habits are not good. And I think many middle-class Indian people have had fatal deaths affected by COVID-19. So diabetes, underlying conditions like diabetes, asthma, heart conditions, and unfortunately, the government has not released deaths by race. I don't even think it's by gender. It's aggregated at the moment, and I'm sure there's a perfect reason for that.
Yeah, I think there's a last question of this talk, and that is coming from Rishabh Yadav. In the reference of like he has written, how do you see Indian and Indian African efforts to waive TRIPS? I don't get what this waive TRIPS. Will WTO accept our proposal or request, and give also express your views on the role of WTO these days in this crisis times? How WTO can play an important role, vital role in this crisis? What do you think, Professor, on this? Professor Gopal, am I audible to you? Hello, am I audible to you, Professor Gopal? I think there's some network issue. Meanwhile, I invite Bobby, Miss Bobby. Bobby, I'm audible to you. Are you able to speak something on this topic? I know you are traveling, so it's very difficult. So, if you want to make some comments on.
Can you hear me?
Hello, I'm audible to what?
Yes, sir. Yes.
Okay. So, Professor, there's a last question. How do you see the role of WTO in this crisis era, COVID crisis era?
Can you hear me?
Yeah, you are audible. Yeah, Professor.
Oh, okay. I had to reconnect. My audio disconnected.
Yeah.
So I didn't hear that question. If you may please repeat. Is the COVID crisis?
Sorry?
Sir, repeat the last question, sir.
Yeah, the last question is like one of the students had mentioned, like how do you see Indian African efforts regarding this wave trips? Wave trips, waving the trips. And will WTO accept our proposal or request? We means the request of India. And also give express your views on the role of WTO in this crisis era. How do you see?
Okay, mine is going to be an inexperienced view of the WTO because I'm not too familiar with them. But I can't imagine the WTO wanting to deliberately relegate any of the economies. It won't do. I don't think it would help the global economy. So that's my view in terms of that. And I'm sure they would recognize and they would try to assist as far as possible. Yeah, and then Africa, I don't know if it was Africa, India. I think we have lots to do going forward, especially in terms of the crisis. The one thing I want to share with is when COVID began and we were scrambling, I was one of them scrambling around for literature. And
Yeah, Numan Bhati, mute yourself. ICT, please mute Numan Bhati or remove Numan Bhati.